Hello, my name is Amin. I'm dentistry student. In this video, we will learn different parts of a dental syringe and also how to assemble it. A dental syringe is used for numbing the area where the treatment is needed as a part of preparation for actual oral care procedures. Okay, let's check different parts of a dental syringe. This part is handle or thumb ring, which by it dentists can control how syringe will move, and it's used to push toward the carpet. This one is a finger grip, which helps to control a dental syringe better. And this part called barrel, which anesthetic carpool will be added to this area. This part, which is moving, is a piston rod or plunger, which pushes toward the rubber stopper and release anesthetic solution through the needle. At top of it, top of piston rod, there is a part which called harpoon. It's a sharp part which penetrates rubber stopper once the carpool is pushed. This part is rubber stopper. And last part is needle adapter, where the needle will be placed. Okay, let's try to assemble this dental syringe. First thing we need to do is add carpool in the barrel. So we open the dental syringe and add the carpool inside from this side, needle side. And we close it. Now we need to engage the harpoon by putting some pressure by thumb ring. And last step is to attach the needle, so we try to do it straight. And now let's try it if the syringe works properly. And now we can do our injection. Thank you for watching this video. If you like it, don't forget to subscribe my channel and also press like to this video. Thank you.